all about what is this movement all about. That's why we are here today. Quickly tell us, if you joined us on Facebook, can you quickly chat? Let's know where you joined us from. Yeah, so we are ready to go. We are ready to go. Hello, everyone. I hope you're excited. If you're a woman, you are here. I'm celebrating you. If you're a woman, I'm celebrating you. I'm celebrating you because you are beautiful. I am celebrating you because you are special. And if you're a man, you are here. Oh, we are celebrating you because you are so concerned about the life of women. We are here to learn together. We want to talk about women's health. So can you quickly tell us where you joined us from? Please, we want to appreciate you. We want to recognize you. Tell us where you joined us from. These are second edition. Part a girl, part a woman, and bone health awareness. Okay, today, without wasting so much of our time, we are here to know what this movement is all about. What is this movement all about? Why are we coming together? What are we talking about today? What is this part a girl? What is this part a woman? What is the bone health awareness? What is all this all about? And of course, when we talk about part, and of course, what it reminds us of is what? The monthly cycle of a woman, the monthly cycle of a woman. Why is it so important? Why are we talking about it today? Why are we talking about this? Why is it a campaign everywhere on Facebook? People are talking about it. That is why we are here. So I'm going to be introducing, we have so guest speakers today. We have so many guest speakers today. We have wonderful women that are here to share with us. And we also have a special guest. When the time comes, we will know her. Of course, our leader, Uzamaka, will introduce her. We are privileged to have her. She met her on Instagram, and they were also sharing, about the woman's health and some challenges. And she told her, you need to be on this meeting. And we are honored to have her today. So we'll be having Lady Stella Eke. She's here with us. She's the commissioner, Imo State Girls Guide Association. And also, we are having two-star director, Onyinye Eziami. We are having also Uzamaka Sike. She's a nurse practitioner. And we are also having Adama and Morsu, and my humble self. And my humble self, I am your host today, Choma Omoma Edosa, and I am hosting these amazing women and all of you that are here today with us. What are we talking about? And who is here? Oh, everyone. Permit me to introduce our main speaker for today. Our main speaker for today. She's an amazing woman. Her name is Adama Mosu. She is very enthusiastic about health and wellness. She has interests of rural women and girls at heart. She saw my post. Immediately I posted this, I shared about part a girl, woman, and bone health awareness. She just commented and said, wow, I have been nursing this. I said, come on, we need to collaborate because that is the age we are now. She's my special friend all the way from secondary school. You can imagine. So we'll be sharing so many things, so many experiences, as women, as girls. She's a YouTuber. Wow, you need to check out this woman on YouTube. She was formerly Variety Mom, and now she's Adama Mosu Vlogs. Please go and check out her YouTube. She's a mother of 3 and a wife to an amazing husband. And she lives in Germany. So please, house, can you permit me as I welcome our main speaker for today? Let me spotlight her. Our main speaker for today, Adama Ann. Can you please drop some emoji? Let's celebrate this beautiful woman in the house. Please celebrate her for me.
I'm so excited. Thank you very much, Chioma.
Good to have you.
Yes, good evening, everyone. I am so honored to be here right now. Like you guys cannot even imagine. Thank you very much for having me. Wow. Yes, we have been from, friends from way back. We have come a long way, like you can ever imagine. And meanwhile, I'm a mother of 4. You missed one. Okay. So yes, as like you said, Choma, you saw me on you posted on Facebook, and I was so excited about this, whole thing. It just got in my head, and I was like, what? Like, this is a sign that this is something that needs to be done. I just told myself this is a sign, because I've been like, telling myself I need something to really tell me that this is something we have to do. All of a sudden, I saw you post this, and I became so excited, and I was also ready to share my experience. Thank you very much.
Okay. All right. Thank you so much. We are so happy to have you here today. So some time ago, I came to your wall and I saw something you posted there. I saw so many reactions coming, even on YouTube, meaning this particular thing, it's like a concern and a burden to women. What is that thing? What did I see? I just saw a pant. You had a picture of a pant and a smelling face, like a stinking face. I said, this is so interesting. And the post is about women. It's about women, inching, how they can, stop that inch. I don't know. I can't really remember the caption, but I know it has to do with, inching. People have been experiencing, a lot of women experiencing inchings and all that. And you were talking to them, and I saw so many people commenting. Many people comment. So it's like a particular concern. It's like, so I want to really ask you today, Adama, what led you to having posting that? What's really happened? Why did you come up with such a thing? And what was the reactions? Yeah.
Okay. Okay, so let me say it this way. Itching is a problem. I don't know about men, but for us women, I know I'm not the only one. Itching is a main problem we have, right? I don't know about any other person, but I believe I'm not the only one, because this is something that happens to me also every time, like as far back as I can remember. Okay. So, and since it's a body, it's a burden, and it was a burden and still a burden to me, I also assumed like every other woman out there is passing through this, like whether we want it or not. And you can also see people complaining when you go to different women's groups. You will like read from people pitching this one, that one, and there are different, stages that we have in a month. We have our menstrual flow, we have ovulation, we also have another time when we are dry and all whatnot, and a lot of things can come up in between. We are constantly, having something down there, and sometimes we also get wet, right? We also get wet from sweat and also from fluid coming out from there. And all these things, when we stay, we could get itching. So all of a sudden, one day, I saw somewhere that you could use like something local that is not expensive to actually take care of this. So I went ahead to make a video and share with women that you could use something. You don't have to always go out there to buy drugs, because sometimes they don't work, right? So that was actually what led me, because this is a concern because of itching being a concern that women have in general. Hello.
Okay,
did anyone hear what I said?
No, we didn't hear the last point of it.
Okay, sorry. I'm sorry about that. I said, so what actually led me to it was because itching is a main concern that women have, from pregnancy to menstruation to ovulation to our in-between dry cycle, where we are neither too wet or too dry or whatever. So that's all those things are really here and there. And sometimes when we urinate or use the toilet, we cannot help, especially when we use public toilet, we cannot help ourselves. We can't stand to do it. Like, it's just one way that we can do this thing. And because of that, this itching is a main problem that women have in general.
Okay, I don't know what's happening, but you're breaking.
I'm breaking again?
Yeah, okay, yes. But, uh-huh. Okay. Oh, we lost her. I know she's coming back. I hope we are
okay now.
Okay.
Can you check on the Facebook streaming? It's no longer showing.
Yes,
it says ended.
Yes. Let me just share the YouTube. Well, on YouTube, let me just share the YouTube, please. Yes. Okay, go ahead. All right.
I'm so sorry about the break in transmission. I said my last point was that itching is the main problem that we have, and it could, you know, go from during our menstrual cycle, when we're having our periods and ovulation, and it also goes further to our in-between cycles where we are neither here or there, and also for the fact that we usually kind of have to use toilets that are not ours at home. We have to use public toilets, and we cannot help ourselves. We have to like sit in a particular way or squat in a particular way to do this. And by so doing, we usually, like, we are prone to itching and we cannot help it. So that was actually what led me to make that video, to help who are struggling like I was struggling.
Okay, so what were the response you got when you made that video?
Oh my God, yeah. I actually made 2 videos. The one you saw with a pant was actually the second one. The first one went viral, okay? And people were all over the place asking me, okay, how can I do this? Are you sure this will work? And that. And I told them, like, for now, this is the only thing that I know that would help you people, because I wouldn't be sharing something that I've not tried. So this is something that you guys could also try and see whether it works for you. I don't know, right? I saw it somewhere, I used it, and it works for me. So if there is another thing out there, I have no idea. But for now, this works, you know, because the questions were so much, people really wanted to know. And that was to show you that people are suffering, like everybody is hiding under, you know, under good clothes and everything. They need a solution.
And that's why we are here today. We're talking about part a girl, part a woman, and bone health challenge. And why are we talking about this? Why are we shouting? Of course, our next speaker will, you know, elaborate more on this, the need to use a quality sanitary napkin. So my wonderful friend and sister Adama, you attended a girls' secondary school. And I know if you are not a bother, meaning if you did not live in the hostel, maybe you had, you know, some friends that live in the hostel. So what is the situation like? I don't know if you can recall back, you know, those memories, and maybe tell us, share with us today, what are the challenges you think girls in secondary school, in high schools, what are the situations they are exposed to that can lead to, you know, to the concern now why women, you know, are having some of all these experiences and sufferings.
Okay.
Yes.
Okay. Honestly speaking, that has been more than 18 years, right? Okay. But to tell you the truth, I remember everything. And also, I didn't need to like live at the school premises to experience whatever every other girl in that school was experiencing. First of all, we had very bad, let me just put it that way, okay, bad toilets and bathrooms. And none of these girls, including myself, wanted to use the toilet and the bathrooms. So sometimes we would go into the bushes at the back of the school. That was where everybody preferred, because you would at least see a clean place, a clean space to use. And, you know, right from time, this has been something bothering me, like really, you know. And sometimes you also have to, when everywhere was really bad, as a day student, which means I was going from home. So I would, once it was 12 o'clock or 1:30, I would say, okay, when I get home, I would urinate. And, you know, that is already bad for our system, you know, as women. So, but I would do this because we had a very unhygienic, okay? There's no need hiding anything. We had very environment for using, for, I don't know, for easing ourselves. Let me also say that. So nobody was really eager to use those toilets because they were either stinking or you couldn't even look at anywhere at all. So that was our experience. I'm not sure any other person had a better experience than this. This was what I saw, and this was what I went through as a girl in that school. And I'm sure every other person, we were 300 and something in our set. So I'm sure every other person there went through the same thing.
Yes, and I know even some people here too who can also, remember those memories, even currently too, where our children are schooling. Of course, they are not using a private toilet. Everything is public. Everything is public, and we know how our body, the way the woman's body is open. So this is really a situation. This is really something we need to talk about. Those young girls are there. They need us to educate them. Those women are there. They need us to, we need to talk about this, even though we don't want to talk about it, but it is really something that we need to talk about. So the last question I have for you, before I invite our next speaker, is, do you think, unhygienic toilets and underdeveloped sanitary napkin will have future gynecological effects on these young girls? Because talking about then and now, what are young girls, what are some of our rural women they are exposed to? Do you think? Yeah.
Yeah, this is a really interesting question because, first of all, let me talk about myself. I like to tell my story. I like to, talk about my experience because that's what I know. Everybody knows their own experience. So as a young girl, I started my menstruation at around 9 years old. I was in JS1. That was the very first class in secondary school. And I started. First of all, I was confused. I didn't actually know what I was doing. So the very first time, I didn't tell my mom about it because I didn't want her to know, right? So I rolled up lots of tissue paper to stuff down there. So imagine that tissue paper. I can't even remember where I found it, right? I didn't even care whether there was dust in it or whether bacteria or anything. So first and foremost, that is dangerous. I don't even have to tell you or actually let you know. So I do not even need to say it 2 times that is really very unhygienic. And secondly, also, I remember going to my grandma one time and I didn't have neither tissue paper because actually at that time when we were growing up, sanitary pads were kind of very expensive and sometimes we couldn't buy it. And we are not rural kids, we're not rural kids. We of course, we are township. We were township kids. So when a township kid cannot buy a pad for, to use for the month, just imagine the girl living in the rural area, that woman living in the rural area also. So to tell my story, I went through unhygienic, let me say circumstances, right? Growing up, I used tissue paper, I used cloth. I use cloth sometimes and I would wash it and also keep it. And sometimes probably, I can't even remember, but maybe they are not really dry or whatever. And I'll stuff it right back. And of course, I didn't use the washing machine. I didn't use hot water to wash it. So that actually means that there's still bacteria living down there because what we're talking about is blood, right? So just imagine, conclusion lies within us. This is my own experience. And I'm sure some girls out there are still going through this because sanitary pads have honestly become even more expensive than they were that time. That's true. Because of that, let me put this lastly, because of that, a lot of people who call themselves merchants, who call themselves businessmen, are going into China and bringing all whatnot to us, to these girls, to people to buy in the name of buying sanitary pad, which is really even more dangerous. So we could contact diseases, contact even more, you could even have more itching down there, and you could contact other gynecological diseases from these things.
Wow.
People
Thank
need
you
help
so
out there.
Yeah,
Really.
thank you. Oh, thank you so much, for sharing. Your last point just made me so emotional, sharing about your personal story. And if I maybe make room for one or two people here, they will also share that, the same story or something close to that. Because these are situations that you find out that these young girls, these young teenagers, some of them, especially those who are not close to moms, who are not open to parents, they experience and they really need help. I know we're having the commissioner here. She's been out there in the field. Maybe she will also share with us the current situation. We appreciate it so much. We'll be calling you back, maybe to give us your last word before we be, drawing a curtain for today. Thank you so
Thank you
much,
very
Ma.
much.
We appreciate, especially
Thank
for
you.
that video you did about, women itching. Wow, that was so good. So I think it's part of the things that also led to this burden that said, oh, if there's something I've discovered that I need to share with women out there, then I have to come out, we need to come out, talk about this so that everyone can benefit. All right, thank you so much. So the next speaker we have now is, let me spotlight her. All right, she is here. Wow, this is an amazing woman. I love her so much. When you come in contact with women that are intelligent, of course, today you will be informed. When I mean informed, you have lots of information. So she is Uzamaka Anosike, and she is a nurse practitioner. She will be sharing with us today, about, her discovery. She will be educating us about long-reach sanitary napkin and the need also for women to take calcium. So permit me and join me as I welcome our second speaker, Mrs. Uzamaka Anosike. You're welcome, ma'am.
Hello, everybody. Thank you. Thank you so much. Yes, my name is Uzamaka Anosike. I am a nurse practitioner as my profession, but today, this discussion today, let's put that nurse practitioner now. Let's just talk girl to girl, woman to woman. That's what I need this discussion to be. Talking about women health. I have a dilemma today, so let me start up front by confessing that dilemma. The dilemma is when Choma asked me to speak about this, it was the passion, the vision, or the mission is there to my heart. But my dilemma is, how can I break down this truth so that my sisters, my brothers, my friends, the stranger that I'm just meeting for the first time today, if we're meeting for the first time, my name is Uzamaka Anosike. You may know me as Uzo Monks or see me around as Uzo Monks. So please, my dilemma today is, how can I break this down? That way we understand the reality of what's going on. So if what I say, I will try not to bombard us with facts, but I will try to make sure that I paint the clear picture. So please, I would expect that you would have questions. It's not going to hurt my feelings, so ask those questions. And thank you so much, Adama, for sharing your story. Your story leads into what I'm going to start talking about. Adama started menstruation at 9 years old. That is early menarche. That means she started menstruating earlier than most girls. Okay, so we'll just skip that. When I use the word early menarche, remember Adama's story. Okay, so again, the CDC tells us that women provide 2/3 of the health care in all of America. Then if you go to globally, women are said to provide up to 75% of care to people. That will be in the home, in the healthcare system. That means informal care and formal care. But then how do we as women have the most difficulty talking about our own health? How is it's like it's too heavy in the mouth to talk about women health. So we're going to start off by going straight to the basics. If you were, I understand a lot of people did not have the privilege like I did to have parents that were that are on the ball. My mom, I'm telling you, there's nothing that passed through that woman's eyes. She told us, she taught us we had sexual health right from the go, so much so that we will have our friends, our neighbors come over to our house so she could do sex education, health education for them. But I understand not every girl, not every child has that information. And again, thank you, Adama, for sharing your story. Imagine that girl like Adama, who even when she had started her menses, did not even have a concept of what it was. How about these girls continuing now, not understanding, not knowing, and still going on to make mistakes, not because they want to, not because that's their preferred place, but just because they don't have the knowledge, they don't have the resources. And thank you so much for the Party Girl campaign, which I say I am solidly behind this movement. We can begin to right those wrongs. We can begin to make it easier for people to go. So let's start from the basics, okay? When we talk about women's health, menstrual hygiene, that is where it begins with. Menstrual hygiene, that we are able to prevent this going on. The girl you're seeing today is going to be the teenager you see tomorrow, is going to be the woman, the young adult you see the thereafter, is going to be the working class, the CEO you see next day, is going to be the grandma you're seeing next time, and continues all the way through from cradle all the way to the grave. So prevention starts is the first place. The World Health Organization, you've heard this data quoted times and over again, that majority of the women health disease issues come from poor sanitary practices. So menstrual hygiene is our first place. The simple thing as wiping from front to back, that is a good information to let the girl child know, even from the toddler. That child you're helping, oh, we're doing potty train, let's get used to, I can pull my pants up, I'm a big kid now. Continue as you're teaching them to clean, as after you eat, after you urinate, wipe from the front to back. Everything goes away. This is our good place. We want to keep it clean. We want to keep it healthy. Okay, so those are simple menstrual hygiene that we need to, as parents, as brothers, as uncles. This is everybody, not just for the mother. Okay, again, also, then you talk about the hygienic products. So what products are you using? Yes, there are different hygiene products you can use for menses. Yes, there is the sanitary towel, which is the one we're focusing on. There is the sanitary cups. Okay, and then there are tampons. Those are all options. Okay, but knowing that for each choice we have choices, but helping this girl child make the right choice. Again, we cannot shy away from being the world's top number of caregivers, shy away from our own gynecological health. Early detection is key. We've talked about cervical cancers, breast cancer. Actually, let me take a moment. If you know any lady, October is also Breast Cancer Awareness Month. So if you know any lady, or if you currently are going through breast cancer, be it you're a survivor, you're in remission, you're going through chemo now, put a double hat. If you're a person with breast cancer, double hat in the chat. If you know somebody with breast cancer or know a story of somebody with breast cancer, single hat in the chat. So double if you're the person, single hat in the chat if you know somebody that is going through breast cancer. Early detection, your monthly breast exam. When is the best time to do your monthly breast exam? At the end of your menstrual cycle. Okay, so early detection, schedule your gynecological checkups. You say, well, I have a doctor, I go to my doctor. How? But then there is the sick visit, which is, oh, I have something going on now, I need to go to the doctor. But we're talking about the preventive health, the well woman checks. If you have a gynecologist, go ahead and schedule that appointment. I understand some areas you may not have access to a gynecologist, but you have access to your general practitioner. Make that appointment for your well check. Okay, so that would be when to start your pap smear. When do you start pap smears? 21 years. Yes, 21 years. I believe UK is from Europe, I believe is from 25. Okay, so if you've never had a pap smear before and you're over 21 and you're in the US or over 25 in other parts of the country, you are due for your pap smear. Okay, so get that. And again, there is also another belief. If I'm on my menstrual, okay, let's say now you've now scheduled this, your GYN check, and then you're on your menses. Please do not cancel your appointment just because you're on your menses. Do not cancel your appointment. Even if you're going to get your if you're getting a IUD done or even the pap smears done, that is okay. Your doctor can walk around us. So because again, these appointments are hard to come by, you've rescheduled things to get them set up. If you have an appointment scheduled, please don't cancel it just because your menses you're on your period. So those are the things. And again, I don't know how to say this one, but I'll say it. Seriously, your OBGYN doesn't care how that place look. You may say, oh, I need to get it waxed first. I need to get it all this prepped up first before going in. No, that may make you feel better. Of course, you don't, you come up clean, but please don't let that keep you from going in, because your doctor is looking at the health. He's looking at the cells. How is the health? How is the, how is it going? Is you have infection growing, things like that. That is what the doctor is looking for. But the aesthetic, let me clean up, let me shave, let me do this, that, please don't let that be a bias or keep you from going. So what am I saying in effect? Nothing should stop you from scheduling your GYN checkups. Early detection is key. Everything we're going to talk about in adulthood, early detection helps us get it done. We have to act fast. I can tell you, I, for one, oh, my tooth aches, it can hold on, oh, something is not working out well, I can wait a little, let's hold off some, hey, it's just starting, it's just small. What are you waiting for? Something that even there is the adage that say a stitch in time saves 9. So you want to act fast to be able to get this under control. And what is this basic is care for you, the girl. And you can say, well, I'm grown now, I'm old, I've finished having my children. What else, Kwanu? What else is there? Let's leave it for the young girls. No, every woman, a 91-year-old woman, a 100-year-old is a girl at heart. Okay, so care for you at every stage in life. At every stage in life, there are women health care that you need to take. You need to take into consideration. Your challenges in earlier life may be different from your challenges in later life, but whatever is, make sure that you are taking care of you. So I needed to make sure that we got those basics, especially because I hope that at the end of this series that you will be able to, because that is the goal, that we have more people sharing, we have more people educating the girls that we are, because we are not only just putting pads in their hands, we are giving them the right education, the information they need to make the right choices, whether we're in the room with them or they are by themselves. Okay.
Wow.
All right, now let's talk about some things where so what are the common women health issues? All these things here, you will find out quickly that something affects the other. One thing affects the other, affects the other. Okay, then let's talk about, and I will try, my time I know is short, so I will try to go through this in just like using stories. Okay, so you have the uterine or related problems. So you have your endometriosis, you have fibroids. Some people will say, okay, what's the difference between fibroids and endometriosis? That's again where your GYN checkup comes in. The symptoms may be the same. So that means you're having the heavy flow during the periods. Your periods are lasting longer than the regular 4 to 5 days. You're bleeding in between, you're spotting in between is more, tells me towards more of the cancer side, but heavy bleeding, you're having pain. This will be the girls that you find out when they're in their menstruation, the whole school knows. For those of us that were in boardings, you talk about this will be the colleague you have that keeps missing work. It's like clockwork on the clock. They don't show up to work during their periods. This will be the people that can no longer now begin to depend on medications, pain medication, pain pills, to help deal with the symptoms you related to this. Now we talk about infection. Bacterial vaginosis is the most common vaginal infection. It's more common with people that are sexually active, but also, and it increases as you have more sexual partners, but it can be seen in people that abstain. So that one is not well understood, but it's the most common. This is the one that, even the clinical test is the whiff test, is the fish, that fishy smelly odor, the one that you're like, who just passed? That's bacterial vaginosis. That is a infection. Yes, you treat it with antibiotics, but we have a solution again that we will discuss with you. So bacterial vaginosis just leads me into infections. You talk about the urinary tract infections that affect women like that, okay? Then you have the hormone-related problems. The hormonal system is a complex wave. This hormone releases this one, affects this one, affects that one. But let's bring it down to the women health. We're going to talk about the hormones that regulate our menstrual cycle. So your estrogen, progesterone type of hormone. So when there's an imbalance or hormonal imbalance, that also leads to a lot of issues. Again, this hormones is your feel good. That's also what you see during the premenstrual, the PMS, premenstrual syndrome, which some people report that PMS is worse than the menstruation itself, because that is the area or the time where you have the most hormonal changing, and of course there's imbalance going on. So that's when the people are irritable, you don't want to come around them, they are depressed, they are like wicked witches kind of attitude that occurs there. Now, osteoporosis. How does, we're talking about menstruation, how then does osteoporosis come into this? Well, osteoporosis just means you're having there's brittle bones. But before we even get to brittle bones, there's osteopenia, which is when it's low. In osteoporosis, women, which we'll see this more in older women, you begin to see them they didn't fall, but they have a fracture. How did that happen? Somebody can be doing exercise, nothing strenuous, and they broke a bone. Okay, so all those pathological fractures begin to occur. Why? Because of osteoporosis. That means the bone is disintegrating, is losing its strength. Why does this affect women more? Because again of the menstrual cycle issues. Okay, calcium, women lose calcium a lot during menstruation, breastfeeding, pregnancy. So we expend more calcium than our male counterpart. And if we don't take action immediately, a higher percentage of osteoporosis is women related. Again, one thing affects the other. For people that have uterine related problems, one of the treatments is the GnRH, which is the gonad releasing hormone, is a class of medication. Okay, that medication helps treat like fibroids, endometriosis symptoms. But something it does is it demineralizes the bone, so it makes the bones brittle. So we're treating now one medicine, but the long-term effect includes osteoporosis. Another thing is our ladies that women that go through cancer chemotherapy, with that radiation exposure, those things also demineralize the bones, and you have more problems with osteoporosis. So that is why I tell people, you have a symptom, but it may be leading to different things. So again, goes down to the basics, following up with your gynecologist, because every woman is unique. Every woman is unique. So you want to make sure that the girl child, starting from early stage, begins with those basics. And as we go through, that we are keeping up with our care. Of course, cancers, like we said today, breast cancer is the most common. Breast cancer is the most common one. And then you have the cervical cancer, which again, high percentage correlates with poor hygienic or poor sanitary products. Then you have the uterine cancers. So somebody say, okay, how do you differentiate the uterine cancer from the fibroids? Fibroids are masses or tumors that grow in the anywhere. Some of them can be inside the uterus, some can be outside, and some can be in between the uterine wall. But again, that's where your testing comes, because your doctors can do your test, they can do samples, biopsies, and with that they can know if this is a cancerous growth versus just the fibroid growth. Again, STDs, sexually transmitted diseases, infections, other illness, the heart health, a lot of illnesses affect women. That is why, as a woman, we cannot afford, not anymore, to negate the care for the woman. So let's look at that. Any questions so far, or I can keep going? But again, my goal is that I'm keeping this simple enough so that we can get, that we can get the information and be able to share with others.
If you are gaining value, can you please chat on the chat box so that we will know you are gaining value? But we are gaining value. There's so many things I've learned today. Sincerely.
Okay. Yes, all right, then. So now that I've gone through them, I would like to focus again on the uterine issues. So the fibroids. When you talk about fibroids, what are we, when the question becomes, okay, somebody has fibroid, this person needed to go use medication, this person needs surgery, this person doesn't have any issues, this other person has children or had children, nothing happened with it. Another person has infertility related to it. So what it is it fibroid, or is there a different type of fibroid? Well, everybody's unique. So that's why you need to follow up with your established care with your primary doctor and then your GYN. But again, treatment will depend on a couple of things for fibroid. And I am excited because the lady, I don't want to steal the thunder, but we're going to have somebody share her own story with us, okay? So depending on the location of the fibroid, depending on the size of the fibroid, depending on your other history. So that means, is this fibroid, is it causing you to have heavy bleeding? Heavy bleeding, normal.
You want AC?
Normal menstruation for most women is 4 to 5 days. But if you're going over 7 days, imagine the anemia that comes with that. Means your blood count reduces. Your blood count reduces. You have anemia. And what does anemia? And your blood is your lifeline support. That means that's transporting your energy, your nutrients, all that to other parts of your body. Yes, we're talking about just the woman with fibroid, but because this is causing you to have heavy bleeding, you are losing blood. You're not circulating well. It puts you at risk for other health issues. Some show up immediately, some show up later. The most thing that is, we will say, if everything you kind of say do we act now? Do we wait, or do we not do nothing? So for when the blood count begins to drop, then it's time, and you've done your blood transfusion. Again, you're exposing yourself for transfusion related complications also, and you've done the blood transfusion, you're on the hormonal replacement, and again, we still continue to have issues, or the fibroids continue to grow. Again, with the conversation with your doctors, you can now decide what action do we need to take and what do we need to do. And again, preferences. Yes, we come from a place where everybody's expects you have a child, you marry, you have children. That's the cultural norm. But I can tell you that I've met people that their preference is they're okay without having children. That's not what they want, or they want to have children, but not now. Okay, so again, those are the things, the conversations you need to be having with your GYN in a case where you don't have a GYN, with your primary doctor. Now, for even with the people that have the fibroids or heavy bleeding, let's again, I want to keep this simple for us. Let's take a few steps back. I'm calling it fibroids because, okay, I know these are the signs, these are the symptoms. But for you to have a diagnosis of fibroid, you would have had, of course, the heavy bleeding and all that. But talk about a child that at 10 years, early menarche. Again, Adama, thanks for sharing your story, girl. So a child at 9 years starts having menstruation. That child may have normal menstrual cycles, no issue. You may have another child that also starts early, 9 years, okay? But also now has the heavy bleeding, heavy menstruation. Please, dear mommy, dear daddy, do not take those things for granted. Again, we're told, oh, it's part of being a woman. You tough it up when you have children. Let me tell you this one. There's this myth that if you have serious PMS, that when you're in labor will be free. Lie. Lie. No, that is a pure myth. Okay. So that's one of the things. Oh, if you're having serious PMS, don't worry when you have labor. This is a child that is 12 years, and you're telling her to suffer from 12 till maybe she's gonna have her first child at 20.
Sorry for cutting short. There was one we had too when we were in secondary school, that if you're having PMS, menstrual cramp, that once you meet with a guy, it was, oh my God, I don't know if you had that too.
Yeah. that having sex stops it. Yeah. So all these are myths. So these are the things that we need to start correcting for our girls. And also remember that the woman or the mom you're seeing today was the girl that had the same story. And if we don't break that chain, we will continue to do this. It is. Okay, so Adama said it's not a pure myth that has stopped after her first pregnancy. Congratulations. So, but yes, we still have people that even with PMS, menstrual issues, after pregnancy, during labor, still continue to have those changes. What am I trying to say? What I'm trying to let us know is that those are warning signs that something needs to be done. If you, irrespective of age, irrespective of whatever family history you have, you notice bleeding is more than 4 to 5 days, okay? They are painful, they are cramps, you're losing work hours, your life is modified related to menstruation. That is a sign that you need to be checked out, or some conversation needs to be going on with your doctor. Again, remember I said not everybody needs intervention. Intervention could be, okay, let's adjust medication. Let's do some laparoscopic scan and all that. So please just know that conversation, those exams needs to go on. Another chat came in. She said mine didn't stop. In fact, it worsened. So again, that's where it's the myth comes in with the PMS. Okay. Again, I didn't want to digress. So that is something to know about fibroids. So please, that we do not take for granted those warning signs. That is what I'm hoping that we take home. Again, what then can we do? We've listed all these issues. Honestly, if you just from our conversation, I'm telling you, women's health issues, it's so broad that yes, you have specialists. That is all they do every day, and they are booked solid. Our GYN counterparts are hard to come by. They are booked solid every day in the treating issues with women's disease. So now, what do you do? Now we know, yes, it's an issue. It's something we need to take prevention. What can you do? What can be done about it? First, I say, again, going back to the basics, let's start with going back to the basics, making sure that we have that information to share. Now, I would like to introduce to us the long reach sanitary part. It is, again, we talk about hygiene, hygienic practice, and using the right issues. This part, I would just introduce it to us, but again, now key in or tie it back to how it helps addresses some of those issues or symptoms that we have described before. So this is an 8-layer pad. And again, when you're supporting the Pad a Girl campaign, this is what you are actually helping us get out to the girls that will be benefiting from this. So this I have, can you see this? Yes, this is the pad. Okay, this is the pad for during menstruation. Then we have the panty liner. Panty liner, I say, if you've noticed a girl with PCOS, so that's the polycystic ovarian syndrome, endometriosis, fibroids, use the pad when you're not menstruating, because you want to continue to use, and I'll talk to us about the benefits or why this pad works for this. Use this pad when you're not menstruating, and when you're menstruating, you use this because this is the heavy flow pad. So this pad has 8 layers of pure cotton. Okay, so 8 layers of pure cotton. We have your I'll stop sharing and I'll do a closer up close things. Okay, you have your premium soft spaces, safe surface. It has the 3-dimensional flap. So that's like the wing. So you are leak proof. Okay. Then it has your. It has the magnetic anion and far infrared strip. That is the main thing that works, or what we focus on for this pad. Okay. Then you have the soft air paper. It's all made of pure cotton. Okay. No dye. So again, if you were here in the last episode, one of our leaders talked about dioxin. The other parts is made from bleached paper. Bleached paper contains the dioxin. Dioxin is actually a carcinogen. So there is none of that to worry about with the long reach pad. We have the absorbent papers, the soft air paper, air permeable bottom layer. That means when you're moving around, sitting around. I'm hearing an echo. Is that just me? Okay, that's better. All right. So with the air permeable bottom layer, so that means when you're moving around, you're not sitting on nylon or waterproof. Okay. Then you have the release film. So this is 8 layers of amazingness, and we'll look at that. It starts off by being 360 degrees sealed, so it comes protected, unlike your regular one that here stuff can already get in. Okay, again, let's look at the power. This is the main thing. I talked about the magnetic ion and far infrared. That's the major thing in our pad that sets it apart. The cotton, of course, makes it super absorbent, but the health benefits comes from this magnetic anion and far infrared strips. Okay, so why the biomagnetism? We've talked about the fibroids being tumors that are growing, of course, at different rates, different location for different people, but this biomagnetic strip allows the napkin to activate that body, stimulate movement of current. So it helps to keep the blood circulation proper. It also prevents bacterial infection. So for people that are exposed to unhygienic situation, like Adama explained earlier, I went to a boarding school. I would say I thought our toilets were bad though, but Adama, I be like saying our own was. But the same thing, unhygienic issues. So that helps prevents those bacterial infection. Remember again, when I talked about bacterial infection, bacterial vaginosis being one of the most common, it is the most common vaginal infection, bacterial BV. So this also helps kill those bacteria and keep you from having infection. We cannot stop bacteria. And actually, we have good bacteria on our skin. All over, we have good bacteria, so we cannot stop bacteria from being on. But what we can stop is those bad bacteria multiplying and overgrowing, which now leads to the infection. So the biomagnetic strip helps with that. Again, the anion, of course, the anion, that is the one that helps remove the odor. It reduces the smell. It also kills bacteria, and also it refreshes. Okay, anion is considered to be like the minerals of life. So that it has the anions in it, and also helps with taking away just basically detoxifying with the anion part of it. Then you talk about the far infrared. So with this one, this uses, I tell people, again, I'll try not to give us super fast, but this is something you need to know, that the long reach sanitary pad contains the far infrared that its wavelength of 4 to 14 microns. Okay, what does this do? It helps promote circulation and microcirculation, and which helps you prevent the gynecological issues. So these three features put together in the anion strip is what gives you this powerhouse that we talk about in the long reach sanitary pad. This is what makes, again, using the pictures. If you look at this picture here, this is a picture from one of our partners. The first one is before. This was a lady that has ovarian cysts. You can see this is an ultrasound. Ovarian cysts here that required intervention to take care of. But within 10 days of using the anion strip, she insisted on having a rescan before her procedure. And if you notice this sac and this sac, the darker area shows you there is fluid. This cyst is gone from using this panty liner. In her case, the long reach sanitary towel. This anion strip is what gives that, that's what makes it effective in promoting the women health. You talk about the cotton, those are the hygienic part, because you're not adding the dioxin, you're not adding all those bleach and chemicals going on. Okay, but this magnetic ion, the anion and the far infrared, is what gives you that ability for it to be able to help decrease the cyst, shrink a strait, fibroids, keep them or control the growth. Again, everybody is different, but this works over time. That is why I can say use the long reach sanitary pad. get the girl that is going through menarche, give her the pad early in life. That way, imagine, again, just logically thinking through. If a girl is prone to fibroids and she's menstruating, we're noticing, okay, she's having heavy menstrual flow. You can ask, could this be hormonal imbalance? Could this be fibroids? Could it be this? Could it be that? And we start on when we have just smaller sizes using this pad. We can save that girl. We can save that young woman from going on to have this now in adulthood slew of issues from gynecological issues, from the uterine related issues. So that is what I wanted to, I hope I've been able to communicate to us that this pad helps us to do.
Yes.
Okay. All right, then let's talk about calcium. Again, remembering that one thing affects the other. In women, we're losing blood, we're losing calcium, we're losing more than our male counterpart. Then long-reach calcium has 3 components. So you're getting your calcium. It has iron. Iron helps you rebuild your blood cells, and it also includes zinc. Zinc is your, if you didn't know about zinc in the last year or in the last year and a half, you've heard about zinc related to the COVID, or it helps boost your immunity. So even long before COVID, Longreach was already putting these 3 items in a perfect combination for us. So you get in the calcium, you get in the iron, and you're getting the zinc, all combined together. Okay, so daily recommended intake for calcium is 1 gram or 1,000 milligrams per day for adults. It makes sense that women over 50, because we've gone through menopause, the hormones, estrogen, progesterone, all that is now all over the chart, that we need more, because we need to replace. We're not replacing as much as earlier on in life. So women over 50 need at least 1,200 milligrams per day. Every person over 70, that means our men also, of course, you say, how do men lose calcium? Ejaculation is one of the ways they lose calcium. So with men also over 70, they need a little higher. Children children between ages 4 to 18. So that will be that young girl as she's just getting ready or still in the early stages of menstruation. We need to be building her calcium levels up, because yes, that's when they're developing the bones, the teeth, is all that is growing, but also she is beginning to lose some calcium during menstruation. And we talked about osteoporosis, osteopenia for women. So I always recommend that we do calcium and atro for people that are having any joint issues, because atro, yes, is specifically designed for bone health, but again, it also contains vitamin D. So you want to do calcium when you're taking calcium and vitamin D helps go together. So please, if you have the elderly adults, it's always okay to do the calcium with the atro. If you're giving somebody atro just for bone health, you want to make sure that they're taking it also with calcium, because it just makes simple sense that you're replacing calcium while you're focusing on the bone and joint support. So for people that have issues with joint issues, that's the atro to take. So, oh my goodness, my time is right about up.
I know, we know, but the kind of knowledge we are getting here, I don't think people would want us to stop. But because of our time, we have to. Thank you so much for sharing those values. Honestly, to be frank, this is the day I'm hearing that men lose calcium through ejaculation. Please, if you are gaining value, keep dropping it. Keep dropping it. Thank you, Monks. Thank you for sharing this wonderful knowledge of how we can even save that girl child if they can be introduced early to a quality sanitary napkin. I shared it the last meeting we heard about a particular lady who I introduced the sanitary napkin with. Before that time, she told me she was diagnosed of having fibroid, but I don't know the stage, how it was. So I just told her, okay, have you seen your doctor and all that? Before I told, okay, use the sanitary napkin and all that. She shared with me. Maybe I'll pull it up so that everyone can see. So that when we are talking about quality sanitary napkin, this is what she shared with me. You can see. This is the long reach sanitary napkin. This is what she was saying. Initially, I didn't remember again. Sorry for showing you this because I know that so many people wouldn't like this side, but it's just to tell us this is what women are passing through. This is what the young ladies out there, and she's not married yet. She's a young woman. And this is what she said. And after some time, she was still having it. And she said, what did she tell me? He said, you saved my womb. That was what she said, because after that, she told me she was admitted in the hospital and it was confirmed that the fibroid was all gone. So we can see the reason why we are on this campaign. We need to inform people. We need to educate our young girls about the use of healthy sanitary napkin. Thank you, Uzomons, once again. Thank you for sharing those values.
All right. So again, I believe in people sharing their stories. I would. Somebody has two devices connected.
Okay, keep dropping your questions. We'll take them after the next speaker. We'll take your questions. Keep dropping them. We are seeing them. We'll take your questions. Yes.
Okay. All right. So again, I believe in us sharing. Just like Adama had her own story to share. I personally don't have a journey with fibroid, but I can tell you by using the long reach sanitary towel, I can tell people for sure that monthly discomfort is optional. I can tell people since, before the bloating, all that, I can tell people for sure with this pad, if you choose to have menstrual cramps and discomfortable or uncomfortable, whatever you want to call it, menses, is optional. I can tell you since I've started using the long reach pad that I can tell you over and over again, times I just say, wow, thank God I'm on my menses and life continues normal. Something else, please, I need to say, I need to tell us, this pad here was the brand I was using. So it's not like I got something that I didn't use. This was the brand I was using personally before I met Long Reach Pad. Do you know that this pads or the regular pad, because of the bleach, because of the recycled, you may think is cheap, is cheaper. If you put the Naira and the dollar around it, you may think this is cheaper, but please, even the CDC has recommended that you do not use this pad, you do not leave them longer than 2 hours. That you do not leave them longer than 2 hours. Why? Because that is the time the dioxin, the bleaches, the things begin to go. Bacteria grows fast in 2 hours. So that is why, because you have they have basically the nylon wrap, the air is not moving. It is a conducive environment for bacteria to go. So CDC recommends, if you're using this normal pads, that you change them every 2 hours. So if you calculate the pads you have and you're following the every 2 hours, how many you want to use a day now? Okay, so that's 12 in a day. And again, if that's for people that have normal flow. Somebody that has heavy flow already, people that have heavy flow soak through their pads in less than 2 hours. That is one of the signs. Like when you go to see your doctor, that is one of the things they ask you. How many pads do you use a day? How often are you requiring to change? How many accidents are you having? Okay, so just understand that. But with this one, with the long reach pad, it is super absorbent. time is not on our side. I was ready to show you all. This pad holds up to 240 ml. No leak, no proof, ongoing. So it may look, oh, this is smaller, but in the end, this is made of pure cotton. This you use longer. This you feel fresh all day long. Whereas this, you're uncomfortable. You've got boils, basically, irritation just from using this. So all we're hoping to is that through this campaign, that we are educating our girls, that they have the better option, that they know the right things to do. But here with us is a beautiful lady that has her own story to share. This is Everything Fresh. Everything Fresh has a story with fibroid. Again, everybody's journey is different. So she's going to share her own journey with us. She is a female artist in Richmond, California. She's been in 10 years plus in the industry. She's been on tours with G-Eazy, the Heartbreak Gang. If you know, that's one of my lovely songs. The Kelani is one of the Heartbreak Gang artists. She's a rapper, she's a songwriter, she's an actress. She has the Sister Gladys is a character she brings to life. You gotta love Sister Gladys. She's a grandmom character that is super funny. She is a radio and international rap artist contest. She brings her personal. We are excited for her to share her personal journey with fibroids. She is passionate about women health and Party Girl campaign. Please, with your favorite emoji, help me welcome Fresh to the floor. Where's my girl? There you are. There you are.
Thank you. Thank you so much. What an introduction. Thank you so much. So nice to be here. So nice to meet everyone, even if it's through Zoom.
Yes.
I just wanted to say before I get started with my story that I personally wish I would have been able to hop on a Zoom like this before. Because the information that you're giving and the fact that so many other women are experiencing the same thing, that would have just been worlds of information for me to know, because for a long time, everything that I experienced, I just thought was normal. So I never talked about it. I suffered from fibroids in my uterus. I had 2 major fibroids that were on the inside of the lining of the uterus. I also still have 2 fibroids that are along the lining of the muscle. But right now, basically, I've been bleeding really heavily for a long time now. I'd say at 25, I'm 31. At 25, I noticed a really big change in my menstrual, bleeding for longer periods of time. And again, I always thought it was normal. So I didn't really say too much, even to my mom and my grandma. I would kind of complain about cramps and things like that. But I'm a very private person as well. So I didn't let them in as much as I probably should have. At the moment, I was bleeding well over 7 days each cycle, and that was starting from 25.
Wow.
So just imagine how much blood I lost. It was.
I didn't get what you said.
For my faith in Christ.
Oh, sorry about that. Oh, hold on. You are muted. Courtney, you're muted. Fresh.
Oh, you must have muted.
Sorry about that.
It's okay. No problem. So yeah, I'm not sure when I got muted, but at 25, I noticed that my period started to change, get a lot heavier. My cramps started to increase. And again, it wasn't something that I spoke about because I was very private. I just really thought different women had different periods. Most of my friends had shorter periods. They didn't experience the things that I did. So again, I kept it kind of to myself. I suffered from 25 to 31, heavy periods, bleeding over 7 days, losing blood in crazy amounts, bleeding completely through my clothes, having to not even call off work, but even sometimes quitting jobs because the job is not understanding that I can't even move. The cramps would sometimes feel like contractions in my stomach. It would even get to the point where my fiance could put her hand on my stomach and feel the cramps moving. So it got really, really bad. I'd say, so I had my surgery in September. About 6 months ago, I was at work and I was on my period, and it was a really, really hard one for me. And I wasn't feeling well. And I'm not the type of person that goes to the doctor too often, and I have to really be sick. But this particular day, something in my soul just told me I needed to leave work and go straight to the ER. So I ended up going to the ER. And at that moment, when I got there, they put me on an emergency blood transfusion because I only had 4 pints of blood left in my body.
Oh my God.
A normal, I guess, human
hemoglobin
has 14 pints. They say half of that is okay, but it's still, something that you need to look after. And me having 4, my organs were about to shut down. So I had to have an emergency blood transfusion of 3 bags just to get me up to 7 pints. I continued to, bleed. My fibroids were removed on September 2nd. And I can say I've had 1 menstrual cycle since then, and I can say that I've noticed a complete difference. Those 2 fibroids that they removed were definitely giving me the most problems. My body almost thought I was pregnant each month, trying to push those fibroids out of my body. And that's where a lot of the pain I was experiencing was coming from. It was a wild experience for me. Again, even speaking with a doctor and her, letting me know that this is not normal. And me thinking about all these years that I've continuously just lost blood and not replenished anything. I became anemic. My iron was low. Everything got really bad. So the surgery definitely helped me. And it's funny, Uzi reached out to me because of my videos. Sorry, I'm at work, so doing 2 things at once. But Uzi reached out to me because of my videos. And I had, let everyone know that my surgery was successful. My blood count was going back up. But when she introduced me to the pads and some of the products that Long Reach. Yes.
Yeah.
Yes. When she introduced me to the products, I actually am currently on a cycle right now, and I'm currently using the 8-layer pad right now. And I can honestly say this is the best that I've felt, even internally as a woman, hygiene wise, just feeling comfortable, not having to wear extra pads. I was up to 2 pads and a tampon at one point per time. Like it was insane. So this has just been kind of a life-changing thing for me, experiencing a pad that not only can make me feel like this, but it's also working on the inside of me as well, like as we speak. So I don't have too much to share. I just wanted to share my story. I think one thing that I've taken from this is that women, we have to speak to each other. We have to talk about this. We have to be more vocal about this, because I went through years of feeling like it was normal. And at any point I could have died because of how silent I was about what I was going through. So these types of things are wonderful. These types of Zooms, this type of information is wonderful. And we all need to share it.
Wow. Can somebody just appreciate Fresh for us? Just appreciate this beautiful lady. Thank you so much. Thank you
so
much. Oh my God. Wow. Did y'all hear what she said? Her hemoglobin dropped to 4. I'm telling you, we push the buttons when we get hemoglobin back on 6 and 7. We're pushing those buttons. So to think that she, and again, let's talk about something. Let's talk about something, please. She went from 21 all the way through 25, sorry, I got the numbers wrong. 25 all the way to 31, 32 before things get really bad. What is happening? That hemoglobin did not drop from the normal 14, 13 overnight to 4. Your normal hemoglobin for women, like she was rightly told, was around 14. You lose more blood, you get to 13. Okay, you lose more, you drop to 12. Our body tries to compensate, but that compensatory mechanism can only go too far. Okay, so you drop again, you're becoming anemic, you drop to 8. That is pretty pushing it for a woman. Okay, your body is compensating, but now at hemoglobin of 8 has hemoglobin of 7, your body begins to decide what is the most vital organs that needs this blood supply. Okay, so that means okay, instead of us supplying to the nerves, instead of us supplying to the brain, instead of us supplying to the heart, instead of us supplying to the kidneys, to the livers, we're going to just give them a little bit to keep going. Then you continue losing blood, you're not doing everything, or you're not doing anything. You then go into, it's like, we don't know what happened. She went into shock. Shock still simply means the whole body didn't get what they need, and the machine is finished, it's done. Okay, so please, that is why we're hoping that what we're doing is that we can start now to get people before we're needing transfusion, before we're needing, and I'm actually, she just answered one of the questions, which would be, knowing what she knows now, will she consider using a product that would help her reverse or help her? And something you need to know from her story, and thanks for sharing with us, Courtney. She hasn't shared this much details, and I'm glad she did. So again, the fibroids we're talking about, it's not, they're different. They can go anywhere. They can be in different locations, different sizes. Like she said, they took out the ones that is most problematic. People with fibroid, the myomectomies are 50%, and we hope, you always hope for the best, that you are on the better side of that 50%. So even somebody with fibroid might have gone through the myomectomy, which is a surgery to remove fibroids. They may still have fibroids reoccur. They may still have the ones that is left begin to act out. Okay. Somebody can ask, why don't they take all the fibroids off at once? No, you don't do that, because you can run into problems with, depending on what location the fibroid is, or whatever, some of them could be the structure, how the fibroid is shaped. You don't want to cut it. Sometimes they'll say, okay, let's just shave part of it and make sure that it grows. So they don't, and I've had people ask that question. They did fibroid surgery. Why didn't they take everything out? Not everybody can, taking everything out could be detrimental for the patient. Again, you've heard us, I'm beginning to sound like a broken record. Go back, have those conversations with your doctors. If you love Fresh for sharing her story today, go ahead, please celebrate this young lady. And I am glad she is on the other side. The journey continues, but now she already is reporting with the language pad. So we'll be talking after this, Courtney.
Yes, thank you so much. Thank you so much, Uzamaka. Thank you so much, Uzamonks. We appreciate you. We appreciate also for bringing in Fresh to come here today to share her story with us. So from what we've heard today, we've heard it also from Fresh, what she said before now, that she uses, I don't know if I heard her correctly, that she uses like 4 or 5 pads, but now she's going by 1 or 2. You can see, because she was introduced to, a quality sanitary napkin. So please, this is something that every one of us should be concerned about. That was the reason why when I saw my friend Adama said she's also having this burden, I said, we need to collaborate. There was something she also mentioned. She said, women, we need to talk to one another. Did we hear that? If she was not open to talk to maybe Uzamaka, she wouldn't have found the solution of, getting long-range sanitary napkin. And that is why I want to call the next person quickly. I know our time is already up. We're not going to take, more than 5 or 10 minutes again. I want to invite Star Director Kate Eziama. If she's here, I'm trying to spotlight her, but I can't find her. Please, Star Director Kate, if you are here, can you please say something so that we can spotlight you? If you are here, ma, can you say something? If not, okay, let me invite Lady Stella. Are you here, Lady Stella? Lady Stella. Okay, so I would want us to take like few questions while we wait for, SDK. Leader Uzo, can you please take some few questions we have here?
Sure, my pleasure.
Yep.
Okay.
Right.
To start off answering the questions again, remembering that everybody is different. You need to be consulting with your doctor. We'll share the recommendations for what we know, what we've experienced. This is our stories. This is our individual. If you listen, even just from the two people that shared, Adama had a unique story, Fresh has a unique story. So I would answer those questions to my intelligence, but also please knowing that this does not take the place of your doctor who is treating, who is assessing. Again, you need to go in, open your leg, man, and look and well. Okay, you need to go in for those assessments together. But yes, I can answer questions for you. There was one I believe I saw that asked about gout. I'm trying to find that one.
Yeah, I saw it. He says that can someone who previously suffered from gout take calcium?
Okay, so somebody who let's think about this gout. So gout is usually the I don't know if I would call it different types, but there is a type, let me say there is a type of gout that is called the calcium CPPD, which is a type of gout, or that's actually pseudo gout, but it's from calcium, excessive calcium deposits in the joints. Okay, so I always say for calcium and gout, what are the things that flare up your gout? If you have PPD, which is pseudo gout, but from deposit of calcium, you don't need to be taking calcium. That's that. I wouldn't recommend you take calcium. But again, if you have gout, the regular gout, what are the things that flare up? What usually will be foods that are aged food, things like that. Again, following your doctor. Even people with gout, if you have hypokalemia or low calcium count, your doctor will be making those exceptions for you and let you know what doses you require to take. Something else we need to know, that calcium, yes, we know that calcium is good for bone health and teeth health, or bone and teeth. That's I think from primary school they start telling us that. But calcium also regulates other things. So that means calcium is very involved in the cardiac function, so much so that there is a class of drugs called calcium channel blockers. So because the calcium helps with how the blood flow goes. So calcium is also involved in heart. It's helped in the blood pressure regulation. Calcium is also good for muscle. That's why when there's low calcium levels, people may have muscle cramps. Calcium also is involved in nerves. So calcium is also involved in some, not well understood, but some in memory. So again, calcium just goes beyond bone and teeth. So you need to, again, get back with your doctor and they will guide you on that. Okay.
Thank you so much. There's another question here, even though it's not related to what we're talking about, but since we're talking, generally about women's health, maybe you can also help her. She said, please do our beauty capsule, that is the Menguin, increase fibroid in a woman with fibroid.
Okay, so Menquen, I want to say, because the Menquen increases the, I want to say, do not take Menquen if you have fibroids. So treat the fibroids, then start Menquen, okay? Because Menquen it increases the hormones that help the woman, overall woman, and some of those hormones also feed fibroid. Okay, so it's usually good to get the fibroid taken care of, then start the Menquen treatment. And I stand corrected if I'm wrong on that, but that's how I've kind of thought about it over time.
Okay, thank you so much for that. Then I think I need to spotlight Adama, because this next question, I want her to, say something to us. Mm-hmm. Yes, you're still here. All right. Okay. Your camera is now on. I hope we've taken all the questions, because I can't see any other question. Taking all the questions. All right. So I just
saw SD.
Okay. All right. Okay, SDK is here. Okay, from what you've heard today, Adama, I just want you to, because I know every one of us now, we are so emotional. Personally, you can see that my voice tone has changed. What do you think, we can do as women? What we've heard today, with the knowledge, Uzo have shared, as a nurse practitioner, what can we do? What can we do today that will help, all our young ones? Because for we women, we are grown. Some of us are having that challenge, but for the younger women, the youths, our girls in high school, secondary school, what advice are you giving those of us here and people that will be watching this video, so that we can help some of all these challenges that's being faced with women, by women?
Okay, thank you very much, Chioma, once again. Thank you very much, Nurse Uzo. I mean, I felt like I was in a medical conference. Thank you very much. That was really great and amazing.
Okay, thank you, but that was what I was hoping not to do, that you wouldn't feel like you came into
it was amazing. Such that, let me just say something. You know that this is a topic that we don't usually discuss, right? So, like, a lot of questions that we have are questions of things we've never really heard before, and a lot of, like what you said, we take a lot of things for granted.
Yes, ma'am.
Like seriously, now on Monday, I'm going to make an appointment, because I've been pushing it for so long. Like, I need to go. I think it's been 8 months now. I went to my gyno. I really need to go there once again, but I've been pushing it. But because of all you said, like, I'm going there. I'm going to make an appointment on Monday and see when I'm going to get. So thank you so much for that, at least for pushing me to do that. And I'm sure every other person here has, gotten something out of this. Mm-hmm. So that now brings me to Chioma's question. What we as adults are supposed to do, because we've been through a lot, we've seen women who have passed through a lot of things, and some of us here are still going through one thing or the other, maybe because of also, I don't know, one condition or the other, or even menopause, right? So this is something ongoing in our lives. Even after menopause, then we still have other issues, like it doesn't stop. So one thing we should do as adult women is to start sensitizing these girls. Like, there is nothing else we can do. We need to start working on sensitizing our girls from our homes, and not just our homes. Girls, like, make it a point of duty, like, to call, like, to have something with girls anytime. Make an appointment with a school, make an appointment with a church, and go there and teach the youth church, teach everyone, like, everybody, every girl out there, every woman out there needs to hear this. And we also, by so doing, we would, like, take this particular topic away from, oh my God, don't say it. Because growing up, our mothers did not even feel free to talk to us about these things, right? When you say you have heavy flow, like Uzo said, they'll be like, it's normal. Like, for me, Mine wasn't normal. I didn't have any heavy flow, but my PMS, oh my goodness, I wouldn't go to school. Like it disrupts my day. I wouldn't go for lectures. Choma, you were there through university days too. I wouldn't come for lectures. I would vomit all through, and I would try to force myself to sleep, because if I don't get that sleep, it's not going away, right? I would vomit and like so many things going on. But my case was different because I went to hospitals and they said mine was normal and it was going to go away. So I relaxed and took it as one of those things. So imagine a girl out there that her parents were not able to take to different hospitals like I did. And this girl would, perpetually remain scared because you don't even know what's happening. It's not happening to other girls and you are scared. You're like, oh my God, I don't know whether I'm normal. I don't know whether I should do this or that. And you're going through this for 18 years or so until whenever.
Okay, and let me support what Adama said, because then this is where we come in. Like she said, she went to hospital. Her parents thankfully knew enough to go get her checked out. There is a window. Remember the medical people, we have guidelines. So again, somebody for you to be put on medication or prescription for any diagnosis, you have to, have met a mark or somewhere in the diagnosis book for that. What about people like you that are off the diagnosis radar, or maybe they've considered the benefits of the treatment versus the side effects of the treatment? Okay, and say, okay, you're young, we wouldn't start you on a medication that we know in the future is going to demineralize your bones or something, and then what do you do in between? That is where we come in.
That's where this comes in, of course.
All right, so for you, the parent that's taking your child to the hospital and they say, oh, it's okay, it's normal, that is good news that you don't need intervention right away, but that doesn't mean fold your hands and do nothing.
Yeah.
Thank you. So good.
You're very correct. So that's where all this comes in. Mm-hmm. That's where when we sensitize our youth, we should also be like able to find out or at least introduce this product, because I've never used any of these products before, right? Yeah. But right now in my head, I'm like, okay, where do I get these parts right now? Like I'm thinking, how do I send it across? This is what I have in my head right now. So I'm sure every parent out there that gets to know about these products, they'll be like, okay, I really need to see this. I really need to know how this works. I really need to use this for myself or my kid or, my cousin, my niece, for them to tell me whether this really works. And I mean, if it works, like every other person here has said, and also the people that have used it that we've heard from, that it has helped. I mean, who wouldn't want something that would alleviate their pain? If all those years I suffered, I saw something like this, I would have really jumped at it, because if you talk of suffering, I suffered with PMS, like seriously.
Yeah.
I would start taking pain medication 3 days prior to it. That was also when I learned to, count my days with calendar, with anything. I count my days. I know when my ovulation is coming. I know my dry days. I know everything, just because I needed to know when my period was coming, so I could start taking ibuprofen. So I mean, we need to sensitize people out there, women, even fathers, because there are also single fathers, right? There are also single fathers that have girls. We need to get this message out there.
In fact, we had some people that went to during the International Girl Child Day. They went out there to educate. It was young men. It was men. I remember those days while we were in school. If you also remember, it was a man that was coming there to teach us about hygiene. Yes, so I also appreciate.
And it was so embarrassing, right?
Yes, that's why women, we need to come together. We need to talk about this because it concerns us. I also appreciate all the men that are here. I am seeing someone from Belize, Mr. Flo. He has been here. He's so passionate about sensitizing women in Belize. In fact, the first time he had to order any of our products, he requested for the pack, because when he heard about the product, what he said, no, I need it for my country. So I want to sincerely appreciate the men too, because when your wife is passing through all this crap, all these pains, even going through surgeries, you find out that it's like the man too is also involved. So what is Adama encouraging us today? That we should go out there. That's the key word. And that is why we're doing this part again. So it's not about long-range sanitary napkin or we want to sell the product, but it's about because we have discovered something that is working. And we want to go out there to share this experience with people, to share so that people can know that there is solution. Just like Ozo said, that fine, if you say, okay, according to World Health or I don't know what she quoted for us, that no, the regular part shouldn't be used more than 2 hours. In fact, the way she analyzed it, I said, this is knowledge. Say more than 2 hours, and people are using this more than 2 hours. So if we are to use it for just 2 hours, meaning someone should be using up to like 3-4 packs for a cycle. But you see, women, we use only 1 pack. Some we don't even finish 1 pack. So how can someone say, oh, I can't use this, I can't get that? This is just like, it's just knowledge we need to pass across. Thank you so much, Ada. Before you give your last word, I want to call on Star Director Kate. Star Director Kate, because she's so passionate about this sanitary napkin, and that is why I want her to also share her experience with us today. Star Director Onyi Kate, are you there, ma'am?
I'm here. I'm here. I'm here.
Okay, we're not seeing your face. All right. So I know that you are so passionate about this Pad a Girl Child campaign, because the first time I shared it with you, in fact, you are the one that came up with bone health awareness. You have to put that together because women need to hear. Okay, so ma'am, I just want you to share your little experience about a long-range sanitary napkin and why you are recommending it for school owners, for mothers, for everyone. Welcome, XD.
Okay, I just want to appreciate all the previous speakers. I want to appreciate you, Chioma. I appreciate Adama, Uzoma, right? And everyone here on this session. A lot have been said today. Okay, in fact, I picked a lot of things when Adama and Uzo spoke, a lot of medical, tips here and there. I picked. I'm so grateful, for this session tonight. And well, I don't know what I'm going to say again. It has been said, but I just want to tell you my personal experience with the pad and the panty liner. For me, I'm someone that likes to draw the things I do from experiences, my experiences especially. Okay. My background is finance, is banking. I've been in banking for about 15 years, So yes, I'm a Star Director with Long Reach International. But what made me to even join the business, to even partner with Long Reach, is this panty liner and pad and sanitary pad. That's the first testimony I had about Long Reach products. So I'll simply say that if not for this pad, if not for the panty liner, I'm sure I wouldn't be a Long Reach partner today. I'm sure I wouldn't even be a Star Director today. I'm sure I may not have even known Pastor Choma. I may not have known Mrs. Uzo and a lot of people here, if not for the panty liner. Okay, so let me just tell you a story to summarize all the things I've been saying. So there's this lady, Sister Oluchi, that came to tell me about Long Reach years back. I thought that I wasn't going to join. And me, I don't understand, the business model. Me, I'm used to my corporate world. And then when she persisted, I signed up and I got the pad. So because I hadn't, I hadn't seen used pad like that before, or rather, let me just say, I didn't even know that a lot of women are actually suffering from gynecological issues that much. Yes, I know I've heard a few people, that had issues with infections and all that, but I didn't know it was that serious. Do you understand? I think I was quite young then. I just got married, very young. So I didn't know a lot about the issues women were passing through. So when I got this pad, I didn't know that the pads are that effective. I thought it was just the normal regular pad, in the market. But then I was using. So I just kept the pad in the wardrobe. I didn't even use them, But then I know Oluchi told me that those pads are wonderful. They, they are good, but I didn't believe her. They could cure issues, gynecological issues, and all that. So I met this lady that was now sharing her experiences with me, how she had been married for about 5 years without issues, how she had been spending money going from one health center to the other. And I told her that I have this product with me, and it say that it does this, it does that. Me, I was like, since I wasn't using them, let me just give them out. So it was actually an opportunity for me to give them out, really. So I thought that I have those products that if she doesn't mind, she can take them. She said, okay. So I gave her the panty liner, I gave her the pad. I told her, since you're trying to conceive, when your period comes, use the pad. Then when you're not ovulating, your normal period, you can use the panty liner. Make sure don't use them when you're ovulating. I just gave her like 2 packs for the pad, 2 packs of the panty liner, So I gave her and forgot about that. She calls me like a month after, more than a month after, that she has not seen her period. I was like, well, okay, if you don't see your period, go for a test now. Maybe something has happened, and she went for the test. And she called me thereafter that she's pregnant. This is someone that has been trying to conceive for 5 years. So immediately she told me that I have to go and remove all those products and start looking at them. That was when I found out, how the components of this product and how effective they are. We didn't have the information that Sister Zomaka is sharing now. We didn't have all those information. We didn't have all those. It was experiences like this, that made us to now go further to start reading about this product. That's when we got to know the properties of this product. So what am I saying? This pad and panty liner, they are wonderful. I'm sure that a lot of us here know how effective and how wonderful these products are. Then coming to this campaign, the Pad a Girl campaign, the way I look at it is most of us here, we are elderly women. This is an opportunity for us to make a mark, in the lives of young people around us. If there is something that you can do for people coming after you, what you can do for them is to teach them the things that you didn't know. You can teach them so they know early enough, and also look for ways to also help themselves early enough. So I urge everyone to key into this campaign with all energy. Okay, key into this campaign with all energy. When next we're going to have a session, let's invite as many people as possible. If not for anything, at least for the knowledge that we women will get, the knowledge I got today and knowledge that we're going to get in other sessions. Let's invite a lot of people, for our meetings. Let's make our meetings more popular, so a lot of people key into this. Okay, so I just want to encourage everyone, to continue to talk about this Pad a Girl. Every woman you see, every man you see out there, tell the person about Pad a Girl. Let's get a lot of people to key into this campaign and make this sanitary pads available for young girls. I keep saying, if we have organizations that donate condoms to people, for free, why can't they donate sanitary pads to people for free? Yes, having sex is optional, but then menstrual period is not optional. Okay, so why should I donate to having to condom, where I should also donate even more to sanitary pad. For me, sanitary pad comes even before the condoms. So I think
Wow. Thank you so much, Ma. You've said so much within this short period of time. At times, some of us, when we get in contact with this product, we like, we don't even know, because we are used to some other products. So we don't even know what this one is, made with and all that. But when people start sharing, just like Adama said, she didn't know about this, but of course, definitely, you find out that is why this campaign is necessary. We want to educate people. There is something we have discovered. There is a sanitary napkin we have discovered. There is a pad. Like if we check other pads, other sanitary napkin, this is just the panty liner. You will see is in our next, maybe in our next meeting that we'll go about. Maybe we would do really, the practical aspect. Maybe we didn't do today. When you touch this green onion here with other pads, you find out that its color it's color, but this one here, if you scrape, nothing comes out. You won't see any dust. It's just to tell you the quality of this pad. So initially, before now, I'm a matron with a Nigerian Girls Guide Imo State. They normally call us, to donate pads. They go out to share pads to rural women, girls in secondary school and all that. But when I came in contact with the knowledge of long-reach sanitary napkin, I said, no, we need to change those pads they've been sharing to long-reach sanitary napkin. Some people started saying some things online, which I would want SDK to talk about before I call on the commissioner. I don't know if she's here. I think I saw someone like her if she's here, because they've been in the field sharing this pad. Some people, there's someone that said something on social media and said that this pad is expensive. If you give them one, will you give them another time? So SDK, I just want to ask, what is your take on this? When people say, oh, this pad is expensive, we buy it at $5, we get it at 2,000 naira, 1.6, and it's expensive. What is your take on this, considering the health and all the things Uzo has shared today with us, and the concern of Adama to come out publicly and start talking to women? You have been having this issue. I know so many of us, we have, but I have a solution for you. And you need to go to her YouTube and go and check what is going on there concerning this particular thing. So it's a problem women are being facing. So now we can go out there and tell all these women, this is what you can use, to help. So SDK, what's your take on people saying, oh, this is expensive? If you pad one girl, are you going to pad them for the rest of the year and all that? Yes, ma'am?
Oh, okay. I just want to use an analogy to explain this. First of all, when people say it's cheap or expensive, is relative, okay? Let me use an analogy to explain this, okay? Most of us here are Africans, okay? And we understand malaria, the sickness called malaria, caused by mosquito net, okay? Treating malaria often and buying a mosquito net, which one is cheaper? So that's just the analogy I want to use. If you want to buy a treated mosquito net, I know it's about maybe about 5,000 naira, but then for you to buy, you can treat malaria with about 500 naira. So it's actually cheaper to treat malaria than to buy net. But then the thing is, how long? Do you understand? How many times do you have to treat yourself malaria? By the time you now calculate all the malaria treatment you're going to have, you can see that it's now more expensive than buying a treated mosquito net. What am I saying? We are comparing the cost of treating going for a fibroid surgery, the cost of having cervical cancers. We are comparing the cost of having uterine cancers, the cost of having a lot of issues, cost of not even having a child. You are comparing the cost of all this and then the cost of sanitary pad. So that's the comparison that you should be doing. Okay, you're going to compare the cost of not having a child, the cost of having fertility issues. Compare it now with the cost of the sanitary pad. So if you compare the two costs, of course, that answer, you should give yourself the answer. You know if it's expensive or not, if it's cheap or not. Anything that has to do with life, for me, is not expensive.
Thank you.
It's not expensive. What's left with life is not expensive.
I also want to add something, please.
Yes, please.
So what I want to say is that the main thing, thank you very much for what you said, which is very true. How many times are you going to treat malaria? Sometimes we treat malaria 5 times in a month, and you even wonder why you're taking the drugs because you took them just 2 weeks ago. So what I'm trying to say in essence is that we need to just sensitize and let this information be out there. And then leave it in the hands of parents or guidance, to decide what, because they need to check these things themselves. But where there would be a problem for the people sharing these wonderful products is when you don't take it out there, when you don't tell people, and you have this amazing thing, and you do not take it out there to tell people and show them that this is what this can do for you. Even that woman in the village, at least she knows that, okay, let me save this little money for this pad. Some people can buy, I don't know how it is, I've not seen it before. someone can buy a carton if they save up money. You know, it's better for you to be using it, like, let me say you use it this month and next month you don't use it. It's better that you're using it at some time, you know.
Thank you.
Sometimes, some days of the month and whatever, than you're not using it at all. Like, we need to get this message out there. People need to hear it and then decide what they want to do with the information that they have.
Yeah.
And then when we have to give it to people for free, then it's amazing. You know, when you get one, it's just for you to test, because actually, if you don't have support, people like buying this thing in bulk and sharing to people for free, of course, you cannot give everybody for free all the days of their lives, but you need to let them know that this is how this works. So that's why you give them that first pack, that they should try it out, and then let their parents, let them have, you know, the changes in their body, and then their parents now decide, okay, I like this and I'm going to save up, because we as parents, we waste a lot of money, like, honestly speaking. We waste a lot of money, and we do not use money to do the real things that we're supposed to do. So instead of wasting money on all those extra things that you don't need, buying that extra handbag, or buying that extra wrapper for the women in the village, you know, and paying for that useless, I don't know, ashebi or whatever, you could pad your girl for 2 months. You could pad your girl for 2 months.
For 1 year.
So we send the information out there, and then we leave it out to them. Thank you very much.
Wow, thank you so much for this amazing contribution. You've just said it all. What are we doing about this information? How are we relating it to people? And that is why we are calling on this part a girl. We're doing it every 2 weeks. So invite as many mothers, you know, invite school owners so that they will hear. The last time, I don't know if the commissioner, she's here. If she's not here, I'll be calling next is Oge to conclude so that we can close. We've already spent so much time. You know, they went out to a private school, and what she said is that some people can afford this part, but they don't have the information. Even in the rural area, they can afford it, but they don't have the information. And the answer I gave the person that came and said, if you pad them this month, can you pad them? I said, 1 pad can treat that, you know, unknown infection, that infection that we don't know. 1 pad, of course, can treat it. Was it not just a panty liner that SDK said she shared with a woman, and she returned, you know, after some months to say, oh, what I've been looking for, I've gotten it. So you may never can tell. Just like Adama also analyzed, he said, yes, it may not even be that they're using it, you know, every month, but at least once in 2 months or in 3 months you are using it, it can go a long way to help. But now it's in our hands. Those of us that are here today, just like Uzo met, you know, Fresh and shared this bad experience with her, and she is also, you know, she came here today to share her story and what her experience is with this part. So if we close our mouth, I'm telling you, people out there won't know. So that is what we are doing. That is what we are sensitizing. That is what we are talking about today. Let's go out there. Let people switch. Let's help women out there, because in fact, the knowledge, I was just jotting down things and all that. We see so many women, you know, that suffer anemia. I have an aunt. It has been, she has been on it for years. Anemia, she has been on it. She's so anemic. Who knows? Maybe at one point or the other, yes, maybe something went wrong somewhere. Maybe it could be her monthly cycle. It might even be fibroid, and she's not sharing with anyone. So this is why we are here. When we come together, we talk to ourselves as women. So let's go out there. Let's seek for support. Yes, I've donated over 20 packs. For those of us who are in Long Reach, we know how much that costs. I want to also appreciate, you know, one of us that immediately after the last meeting, she just zelled $100 for me. And this is helping. We're sharing our letters. We just want to educate. We just want to save lives. That is what we are out there doing. So thank you everyone for joining. We want to appreciate you all for coming on board. Please, Oge, Leader Oge, are you here? Are you here? Or Leader Favor? I know I've been seeing her sharing. But Leader Favor, I want to appreciate you and all the women out there. Leader Choma too, she has been on Facebook. You know, we are having her on our next edition so that she would share with us her experience so far. So Leader Oge, what do you have to say to everyone here in conclusion about this part of girl, woman, and bone health awareness?
I want to appreciate everybody that joined us today. from every part of the world, from Nigeria, from Ghana, from US, from different parts of the world. I appreciate every one of us that has impacted in our lives. And one of those people that has gotten a different view about this part a girl today. I would like us to equally go ahead and share this video. It will be on Pastor Choma's wall. It will be in Enlightened Partners wall. I know I saw it there on Facebook. Share it and let somebody else know. Let's groom a girl. Let's teach a child. Let's teach a girl child, a woman, and then people will be sensitized. People will understand why we are in this project. This project, I would say, is going to take a lot, but it's not going to take a lot. All it needs is for us to spread the word, and people will understand it. You never learn in a day. You never finish learning in a day. We keep learning, and we will change your life when we spread the word. Thank you so much for joining us from every part of the world. We appreciate you, and we indulge with you to come back to us next 2 weeks. So we'll have another meeting come next 2 weeks on the same platform. Thank you, and do have a great weekend.
All right. Thank you, everyone. I want to sincerely appreciate our main speaker today, Adama. Thank you so much. We appreciate you. We appreciate Uzo and Maka. Thank you for sharing so much knowledge. Thank you, SDK. Thank you, Oge. Thank you, all our wonderful women that are here, men all over the world. We appreciate you. Can you please chat? Let's know where you joined us from so that we can appreciate you. I want to start calling your names. I'm seeing Chioma, Sandra, Favor. I'm seeing Dr. Betty. Thank you. Global Changers. I'm seeing Carmen, Flo. I'm seeing you all. Thank you, Oge. Thank you, Mrs. Timothy. Thank you, everyone. Thank you, Precious. Thank you, Zorit, Sandra. Oh, yes. You can also help me if you're a co-host. Let's appreciate people for joining. We appreciate you. We celebrate you. Please go on YouTube, Chioma Edosa, and share this video. People need, to hear this. People need to know what it's all about, because when they see Party Girl, they might just think it's one of those things, but they don't know that we are sharing knowledge here. Save a life. The last speaker that came, she told us something that each time that these our young girls, women, they use this underdeveloped sanitary napkin, they are exposed to 16,800 times. They are exposed to germs, exposed to cervical cancer. He said, then times it for 7 days or 5 days or 3 days, and now multiply it by 11 years. I don't know how old the child is. For 11 years or 15 years that this child, this woman will be, having her monthly cycle. So why do we have this kind of knowledge and we are keeping our mouth shut? We need to go out there and keep shouting it. Party girl, my period, my pride, my period, my dignity. We need to educate women. We need to educate both men and women. We are all into this together. So thank you for joining, everyone. Thank you, those that joined from Nigeria, those that joined from Malawi, Kenya, those that joined from UK, Germany. We appreciate you all. Thank you. Even those that also watched through YouTube. We are also sorry we couldn't, stream it live on Facebook. Thank you so much. We appreciate everyone. You can now unmute yourself and say something.